Now, I'm glad you asked me about the question which you phrased as "it takes two to tango." So this is a question about the contribution of male and female factor infertility. Now, the old-fashioned textbooks, and therefore passed down from generation of textbook to generation of textbook, always said that 30% of the problem was male. But the more recent publications are now saying quite openly 50-50, so 50% male. And those are even gynecological publications which have always tended to concentrate on female rather than male fertility. But I think most of us now accept, not surprisingly, this is a biological system, that it is indeed 50-50. Now, what has been our approach traditionally to whether it's a 30-70 or indeed a 50-50 situation? Our approach has been uniformly to say that after a particular period of involuntary infertility, and that period is part of the difficulty with the postcode lottery, after that period, let us say 2 years, then our approach has been to try to get the sperm to fertilize the egg, some kind of assisted reproductive technology based upon fairly simple principles. The first principle is that if you can create a year's worth of eggs, one a month, so if we can create 12 eggs in one treatment cycle, we must be improving the chances. And if we can, in inverted commas, select the best sperm, then we also may be improving the chances. And indeed, many couples who have spent long periods of involuntary infertility have been rewarded with a family by this means. And so I wouldn't for one moment decry the fantastic and pioneering attempts of my colleagues in reproductive gynecology who have made families possible for otherwise childless couples. However, I think the time has now come when we can look more closely at the couple and we can begin to apportion the problem, the amount of the problem, the degree of the difficulty between those two individuals. Now, I don't want to speak too much about the ladies, other than to say that, of course, as time passes and age increases, we are having an increasingly uphill problem because, as I mentioned earlier, the ability of the female egg, the oocyte, to repair the sperm declines with age. So to a certain extent, we have to look at the couple as an individual and not merely to suggest a one treatment or one solution fits all. So the time has really come to, I think, concentrate on that 50% of the problem, of the difficulty, which rests with the male. And perhaps the most important aspect of this is to explore the reasons for what was most unsatisfactorily, up until now, and indeed still is, referred to as unexplained male factor infertility. This is when a perfectly fit man who has taken all or made as many of the lifestyle changes as he thought may be reasonable, and still, with a relatively normal semen analysis, there has been no pregnancy, or indeed even a failure of one of the ART procedures. Now, in these cases, I think we are increasingly beginning to explore the DNA quality of the sperm, and we are discovering that poor DNA quality, this is the DNA fragmentation, often relates to unexplained infertility. And so when the question was, to what extent does the male contribute to the infertile state, I think we can safely now say it's 50%, and we should also acknowledge that we're beginning to be able to understand a larger proportion of that 50% because of our ability to explore particularly the DNA quality of the sperm head, and thus then to try to find treatable causes of that fragmentation, not only to improve the chance of a natural conception, but also, we think, to improve the outcome of subsequent cycles of ART, whether that be IVF or particularly ICSI.